We are going to repeal and replace the disaster called Obamacare. Countless Americans have been forced into part-time jobs. Premiums are about to jump by double digits yet again. And just this week, Aetna announced it is pulling out of the exchanges all over, but also in North Carolina.
All right, Donald Trump vowing to put an end to President Obama's failed health care law, a law that has come under new scrutiny after the nation's largest health insurers have all announced they're getting out, just dropping out. They say Obamacare is just too expensive to make a profit. In some cases, for example, in Arizona, some residents will have no actual choices because of this whole fiasco. Premiums, they're also set to go up next year. Customers will see an average increase of 9%. I mean, we got no inflation in the economy anywhere, and yet they're going to see an increase of 9%, making the pricey plans even less affordable. And what does Hillary Clinton want to do? She wants to expand Obamacare. Joining me right now is Trump economic advisor and former New York Lieutenant Governor Betsy McCaughey. Good to have you here.
Thank you.
You know, Republicans have been working on this for a while. They have been, you know, even before the whole thing rolled out, they said it's not going to work. Economically, it just makes no sense.
You don't have to be an economist to understand why this is failing.
Well, we'll explain it for people.
Well, and Americans are going to get clobbered with double-digit premium hikes, more than 9%. In fact, in New York City, for example, the most popular plan's going up 20%. In Tennessee, 40%.
Wow.
And for that, customers are going to have fewer choices of plans because Aetna, United Health, and many others are getting out. And they're going to have much more limited choice of doctors, hospitals, and drug coverage. So this is bad news all around. Now, the Obama administration and some of the advocates like Paul Krugman, the columnist at the Times, are saying this is just a little bump in the road. It isn't. This is the beginning of what's called the death spiral. And here's the reason. This plan was based on coercion, right? It was going to force healthy people to pay the same as chronically ill people for insurance. Well, the healthy people decided we're not going to pay that much. 5% of the people in our country need 50% of the health care. So this was like trying to feed a Chihuahua and a Great Dane on the same budget. It just doesn't work.
Right. Right. So it doesn't work. The insurance companies are saying we're getting out because we can't turn a profit in this. So
and it's not just a profit, by the way. I know that Bernie Sanders, for example, is saying, well, it's the profit motive that's killing this plan. No, there were 24 nonprofit co-ops set up in the law to compete with the commercial insurers. More than half of them are already belly up. They couldn't make it work either. It's not the greedy profit motive. It's
well,
they
were losing money. I should point out.
Right.
It wasn't even profits. I mean, one company said they were losing $430 million a year. Another, $500 million. You know, in the
$3 billion a year overall losses.
Goodness.
And here's what really concerns me.
What?
Partisans of the plan, largely Democrats, are saying, well, let's increase the penalties on people who don't sign up. Increase the penalties. That's not the cure for this. Right. Don't force people to buy something they can see is not worth the money. Fix it.
So, okay, so how do you, but by the way, before we talk about fixing it, you said people are going to get major sticker shock on what, November 1st?
Major sticker shock. That's when the open enrollment period begins, November 1st, 8 days before the election, and they're going to find that they have very few choices. In some states, maybe only one. That's like telling people you must buy a car. Sorry, there's only one on the lot.
Right, and by the way, it's going to be really, really expensive.
Really, really expensive.
And so that, I would think, is going to cause a lot of concern about Hillary Clinton and the continuation of this health care plan that just Obamacare isn't working. So
well, and you'll hear the administration saying, don't worry, most people are getting subsidies. Well, 20% of the people in these plans aren't getting a subsidy. A couple earning $64,000 a year or an individual earning $46,000 a year, they're hardly rich, right? They're getting no subsidy. So they're going to see these enormously costly plans, and a couple might have a $12,000 deductible after paying 1/5 of their entire income for the plan.
Okay, so we need a new system. You're saying this is not ever going to work. What is that new system going to look like?
Okay, first of all, Don't give us some 2,572-page bill that members of Congress don't read before signing up for it. You know, Madison, the founder of our Constitution, said, never let Congress pass a law so voluminous that nobody can read it and that a reasonable person doesn't know what's in it. That's Obamacare to a T. Okay. Secondly, don't tell Americans that they only have a choice of one-size-fits-all government design plan. Let people buy what they want. Already there are millions of people paying that terrible penalty and then going out and buying affordable health insurance, right? Let people buy what they want.
Yeah, power to the people. Betsy, thank you so much. Good to have you here.
Thank you.